Davidson to devise a mood index. Yeah, so he would like to
Venerable
devise.
Joshin, excuse me. Venerable Joshin, now I already share the new slides. สไลด์ของอาจารย์หมอสุดแค่วันที่31ใช่ไหมคะ
เนี่ยส่งวันนี้เลย
วันของวันที่1เหรอคะถ้าของวันที่1ยังไม่ได้
วัน
จากคุณไอซ์นะคะคุณไอซ์ส่งมาล่าสุดของวันที่31มี3ไฟล์
แล้วก็วันนี้วันที่
1ค่ะ
วันที่1เนี่ยอาจารย์หมอโทรไปเมื่อตอนเช้าบอกให้เขาส่งไปหรือเปล่าครับอันนี้ลองดูโอเคgo ahead
ใช่อันนี้หรือเปล่าคะ
ใช่แล้วอันนี้
ใช่ครับใช่
yeah okay
ใช่ครับ
yeah this one yeah I would like to focus yeah Dr. Davidson's work on functional MRI brain scanner he found that when people are emotionally upset whether angry anxious or depressed a part of the brain known as the right prefrontal cortex lights up more than the equivalent part of the brain on the left side. On the contrary, when the people are in a positive mood, they feel happy, they feel enthusiastic, they have a lot of energy. So the left prefrontal cortex light up more than the right one. Okay, yeah. So this is a part of the brain. I think I have already talked about the function of different parts of the brain. And also in this figure, I wrote limbic cortex and my emotional brain. Limbic cortex or my brain is related to emotion, motivation, something like that. Yeah. We have already talked about this. Go ahead. Yeah, you can see limbic system very clearly in this picture. Okay, and then the limbic system plus prefrontal cortex, particularly prefrontal lobe. So when they are combined together, we call limbic cortex. Limbic cortex is the mental brain. And as I have already mentioned, you see, the mental brain is related to what we call the office of the brain, okay? And the seat of the brain is situated on the, we call, you can remember Hataya Watu. Hataya Watu is seated on the right atrium. This is the seat of the brain. But the office of the brain is located at the limbic cortex or mental brain. Yeah. Okay, go ahead. This is different parts of the brain you can see. You see the frontal lobe, including the prefrontal lobe that I just mentioned. And then you can see the central fissure dividing the frontal lobe from the temporal lobe. And then you can see the lateral fissure dividing the frontal lobe from the temporal lobe. And then the latter part of the brain we call the occipital lobe. And you can remember occipital lobe deals with vision, seeing, okay? Yeah, occipital lobe, yeah. Okay, go ahead, yeah. No, okay, this picture is not significant, yeah. Okay. The finding led Dr. Davidson to devise a mood index based on the ratio between the electrical activity in the left and the right prefrontal cortex. This ratio can predict our daily mood with great accuracy. It is akin to taking a peek at our emotional thermostat. So this kind of mood index is very similar to we call emotional thermostat. If the ratio shifts to the left, you are likely to be happy, contented, and energized. This is what we call approach system. So approach system is related to the left prefrontal cortex. Okay, this approach system, if it shifts to the right, emotional thermostat shift to the right, you are more likely to be sad, gloomy, despondent, and lacking in energy and enthusiasm. This is what we call avoidance system. So there are two systems, approach system, and also the opposite one is avoidance system. Excuse me. Go to the next one, please. Next one. Another unexpected benefit of mindfulness course or mindfulness meditation was that immune system became significantly stronger. Researchers gave a flu shot to the participants and later measured the concentration of disease-fighting antibody they had produced. Those who showed the greatest shift towards their brain approach system also show the greatest boost to their immune system. So, as you see, the approach system is related to the left prefrontal cortex. And then when we do practice mindfulness meditation, this area will be extensively stimulated. And then it also increase immune system. So from the experiment, you see the researcher inject the flu shot into the participant, and later they measure the concentration of disease-fighting antibody that they had produced. Those who showed the greatest shift towards their brain also show greatest boost to their immune system. So they are interrelated very closely between approach system and immune system. This positive change after the physical structure of the brain itself, the emotional thermostat is fundamentally reset for the better. Given time, this means that you are more likely to feel happy rather than sad, increasingly likely to live with ease rather than be angry, aggressive, and be energized rather than tired and listless. This change in the brain circuitry is most pronounced in parts in the brain surface known as insula. Yeah, we have talked quite a lot about this area, the insula. The insula, you can remember, is a small area situated inside a fissure dividing the frontal lobe and parietal lobe from the temporal lobe. And the insula is related to what we call interoception, okay, and also related to somato sensation. It is the seat of conscious awareness, and so related to the feeling of being alive, related to the feeling of being alive. So we feel that we are living now, okay, it's because of the function of stimuli, insula as well. So you have to remember, I mean, the avoidant approach and approach, okay? And when you do the approach, so it related to stimulation in the prefrontal cortex, prefrontal cortex, and then the avoidant approach is related to stimulation of the left related to the stimulation of the right prefrontal cortex. Okay, go ahead. Now we come to the insula and the empathy. The scientific research using brain imaging, functional MRI, has shown that the insula become energized through meditation, particularly when we practice mindfulness meditation or vipassana meditation. This is hugely significant because this part of the brain is integral to our sense of human connected, as it helps to meditate empathy in a very real and visceral way. So when we practice insight meditation, this part of the brain, particularly the insula, will be significantly stimulated. Empathy allows you to see into other soul, as it were, helping you to understand the predicament being the problem of other people from your inside. With empathy comes through compassion. Compassion means the loving kindness. In Bali we call karuna, and through love kindness. In Bali we call metta. If you look inside your brain using brain scanner, you will see the area buzz with life when you are feeling empathy for another person. Meditation not only strengthens this area, but also how to grow and expand. This area, I mean the insula, particularly the insula. The insula is related to empathy, as I just mentioned. And then when we talk about empathy, it also involves some kinds of compassion, karuna, and also some kinds of loving kindness, metta. But why it is important? Why it is important? Apart from being good for society and for all humanity, empathy is good for you. Empathy and feeling genuine compassion and loving kindness, karuna and metta towards yourself and others have hugely beneficial effect on health and well-being. That's why you see when we do practice insight meditation or vipassana meditation. After we stop doing that, we have to express our metta karuna, or express our empathy to other people, to oneself first, and then to other people, whom you like, whom you associate with them, or even your enemy, the people whom you dislike, you don't want to associate with them. But we have to extend our empathy to all of these people, no matter they are good or they are bad to you. Now we come to the thing that I just mentioned: mindfulness, loving kindness, and positive mood. Mindfulness, loving kindness, metta, and other positive mood. Professor Barbara Fredrickson and his colleague at the University of North Carolina at Chapel Hill have proved that meditation focusing on loving kindness for the self and for others boosted positive emotion that then led you a sense of having a greater zest for life. So this kind of study is very significant. It will be very beneficial to you as well as other people. Just 9 weeks of training, meditator develop an increased sense of purpose and have fewer feeling of isolation and alienation, along with decreased symptoms of sickness. For example, the symptom of headache, the symptom of chest pain, the symptom of congestion in the brain, and as well as the symptom of general weakness, okay, tend to disappear. Different aspects of mindfulness affect different mood. Another research, for example, at University Medical Center at Groningen, Netherlands, show that increase in positive mood and well-being are directly related to becoming more aware of routine daily activity, observing and attending to the ordinary experience of life, and acting less automatically. So when we do something, you see, so if we don't practice insight meditation, if we don't understand the concept of mindfulness, yeah, we tend to do something automatically. It's not associated with mindfulness. By contrast, decrease in negative mood are more closely related to accepting thought and emotion without judgment and learning to be open and curious about painful feeling. It is sometimes because you understand, we call metacognition. Metacognition. So when you practice insight meditation or mindfulness meditation, sometimes you experience something that is related to pain. You don't like it, but you can observe it with detachment. For example, you might experience anger or dislike to some people. Yeah, you can see that, but you are not attached to your anger, to your dislike towards other people. Mindfulness and autonomy. That is, they do not think because others want them to or pressure them into doing something, nor do they engage in tasks just to help them look good to others, or even to help them feel better about themselves. Rather, those who are more mindful spend more time doing things that they feel truly value, or that they simply find fun or interesting to do so. So there is something like autonomous activity. They are able to what they like on their own, and they are able to make their own decision. Yeah, with autonomy. Okay, now we come to the point, meditation and physical health. Numerous recent clinical trials have shown that meditation can have profoundly positive effect on physical health. There was 30% decrease in the rate of cardiovascular disease or cardiovascular mortality, and also a large decrease in the rate of mortality due to cancer in the meditation group compared with combined control. So if you practice meditation regularly, every day, so you tend to have more immunity, and sometimes you see physical disease might be significantly reduced, particularly cardiovascular disease, including cancer as well. There are some evidence that somebody developed cancer and then they start to practice intensive or inside meditation. Later on, the cancer tend to get better and finally disappear. Now we come to the physical, mental health. Yeah, mental health. We talk about physical disease now. We come to talk about mental health. Research by Maura Kendi in Adelaide and Stuart Eisendrath in San Francisco has also suggested that mindfulness-based cognitive therapy may be an effective strategy for those whose depression is not responding to other approach, particularly antidepressant medication, or even other some kinds of psychotherapy, something like cognitive psychotherapy. So, but this kind of treatment, okay, they use both psychotherapy plus cognitive psychotherapy. So we use the term mindfulness-based cognitive psychotherapy. And this kind of therapy is rather well known now, and it is effectively used for the treatment of depression. Most patients tend to get much better. They tend to be relieved from depression because of mindfulness-based cognitive therapy. And it shows that sometimes it works much better than antidepressant medication. Now we come to medication or meditation versus antidepressant. William Kayan and his colleagues in Exeter and Sindel Segal and the colleagues in Toronto show that people who came off their antidepressant and did 8-week course of mindfulness-based cognitive therapy instead did as well or better than those who stay on their medication. So these kinds of experiments show that medication, particularly mindfulness cognitive therapy, work much better than antidepressant. Oh, now this speaker is about addiction surgery. Yeah. So I would like to stop at this point. Yeah. Any question, any concern at this point? Okay, now we come to the other part about diseases. Okay, the next one. WHO classification of disease. This one I have already mentioned this morning. There are 3 levels of mental defilement, superficial level of defilement. Okay, now we come to the WHO definition of health. WHO definition of health. This part I have written by my own writing. Okay, yeah. Another we come a little bit about. Okay, yeah. We can talk about meditation. So you have to understand conventional truth and conventional reality. So in the practice of samatha meditation or concentration meditation, you are supposed to use holy name or mantra, something like Buddho, sound, the sound from chanting. And also you can use meditation device, something like we call kasina. We pay attention on the earth, that we make the earth a kasina for samatha meditation. Now we come to the WHO definition of health. I have written this part on my own. This related to samatha kamatan. Now we come to the other one, the insight meditation. Yeah, we have already talked about this morning. Okay. Okay, this one. Yeah. Okay. So I would like to go a little bit about diseases. According to World Health Organization definition of health, health is a dynamic or interactive state of complete physical, mental, social, and spiritual well-being. Health or wellness has 4 dimensions. The first dimension is physical health. The second dimension is mental health. The third dimension is social health. The fourth dimension is spiritual health. Spiritual health is a new addition in the WHO classification. So at first, when somebody talk about spiritual health, they don't understand what do we mean by spiritual health. Yeah, I think we will get into detail about that. So there are 4 kinds of disease because we have 4 dimensions of health. So there are 4 kinds of disease because the disease is the opposite of health or wellness. So through this way, there are physical disease. The first one is we call physical disease, and then the second one is a mental disease, and the fourth one is a spiritual disease. Okay, let us talk a little bit about physical disease. This one is very easy to understand. There are different diseases of the body, such as disease of the eye, the ear, the nose, the lung, the heart, the kidney, and many other organs. The physical diseases are commonly treated by medical doctor or physician or other doctor who specialize in different field. Okay, yeah. So something like, so suppose we have kidney disease. We have kidney disease, and then we have to go the Ayurveda. The Ayurveda mean a physical doctor specializing in the kidney disease like that. And if we have an eye problem, we have to go to see the ophthalmologist, the eye doctor, who specialize in the different kinds of eye disease. We might have a lung disease, so we have to go to the physical doctor, Ayurveda, okay, who specialize in the area of lung disease. It tends to be like that. The physical disease are commonly treated by medical doctor, physician, or doctor who specialize in different fields as I just mentioned. Now we come to the mental disease. Mental disease, sometimes it is we call mental disorder, The mental disease or mental disorder, they are the same, okay? A mental disorder is an illness with psychological, emotional, behavioral manifestation of associated significant stress and impair social and occupational functioning. Mental disease is caused by a biological, psychological, social, genetic, or biochemical disturbance. It is evaluated in terms of deviation from the normative concept of behavior. So anytime when there is a deviation from the normality of behavior or normative concept of behavior, they tend to be diagnosed as having some kinds of mental disease or mental disorder. Okay, go ahead, David. Yeah, these kinds of mental disease includes neurotic disorder, schizophrenia, or other psychotic disorder, mood disorder. Sometimes they might have we call bipolar mood disorder. They have the symptoms of depression associated or alternate with the symptoms of mania or manic episode. And then they might have what we call medical disorder, substance-related disorder, mental disorder due to general medical condition. Sometimes the patient develop, they have thyrotoxicosis, and they develop anxiety, palpitation, nervousness, yeah, so on and so forth. And suppose they don't get thorough examination, they might be wrongly diagnosed as an anxiety disorder. But in fact, the anxiety symptom is related to the symptom of thyrotoxicosis. Sometimes they are diagnosed as adjustment disorder. For adjustment disorder, there is obvious psychosocial stressor. Okay. Sometimes they are diagnosed as a personality disorder, something like a schizoid personality disorder, paranoid personality disorder. They might have narcissistic personality disorder. They might have what we call uh, borderline personality disorder, and they might have what we call psychological factor affecting physical condition, formerly called psychosomatic disorder. This mental illness is usually treated and managed by psychiatrists, clinical psychologists, or by other mental health professionals. So, as we have already mentioned, you see, the patient with mental disorder is very popular now, particularly anxiety disorder, panic disorder, also panic disorder, or phobic disorder. You see, when the patient develop phobic disorder, they are afraid to go from one place to another place by plane. They cannot get into the airplane because they are afraid of being in the plane, being in the aeroplane. We have the third one is a social disease. Social disease. Some people develop poor interpersonal relationship with others and the social environment. Social isolation increases the risk of sickness and mortality. Sometimes social disease might be related to the danger in the air, water, and soil, and other products we use. Sometimes it related to what we call air pollution or chemical pollution or even nuclear pollution. Epidemic disease such as viral infection or, for example, the COVID-19 is also related to what we call social disease. Okay, social disease is usually controlled and managed by social worker and many other social health team or social health personnel. Now we come to the concept of spiritual disease. As I just mentioned, it's a new addition of the concept of disease according to the WHO classification. Spiritual disease is closely associated with spirituality. What do we mean by spirituality? Spirituality is a belief or faith in what someone calls a higher power, in someone or something that transcends the boundary of self. Okay, it's usually related to the concept of religions. It gives life to a strong sense of purpose, value, morality, and ethics, as well as hope. Prayer or meditation, a spiritual practice of millions, is most widely used. Is most widely used form of complementary and alternative medicine. And now we come to the concept of spiritual disease according to the Buddhist doctrine. According to the Buddhist doctrine, a spiritual disease arises from one mind, which is intoxicated by latent or deep-rooted mental defilement. We use the term anusaya kilesa. Yeah, I have already mentioned deep-seated or deep-rooted mental defilement or anusaya this morning. They are accumulated in the unconscious or life continuum or pavanka, as you can remember, such as greed, lobha, hatred, tosa, delusion or ignorance, moha. Sometimes we use the term avisha, delusion or ignorance, and so on. Spiritual disease and mental spiritual disease and mental disease are closely related with one another, and frequently the former is the root cause of the latter. I mean that spiritual disease is the root cause of mental disease. So the two diseases, spiritual disease and mental disease, are closely interrelated. And usually the former, spiritual disease, is the cause or is the forerunner of the mental disease. Yeah. Now we come to the Four Noble Truths. The Four Noble Truths, you see, when we talk about the Four Noble Truths, we mean we started with the first one is dukkha, suffering. And the second one is the cause of suffering, the dukkha, samudaya, the cause of suffering. And the third one is elimination of suffering. And the fourth one is the way that leads to the cessation of suffering. But in the first Noble Truth, the Buddha talks about different kinds of suffering. And in this discourse, it also includes the four diseases. As I just mentioned, in fact, the Buddha mentioned the four kinds of disease in the first truth of suffering, namely physical disease. The Buddha talks about birth, old age, illness, or different kinds of disease, and finally death. These are related. Birth, old age, illness, and death are related to what we call physical disease. And then we come to the second one and the third one, mental and social diseases, include sorrow, lamentation, physical pain and grief, despair, association with the unloved, separation from the love, and not getting what one wants. So these kinds of symptoms are related to mental and social diseases. Now we come to the last one, spiritual disease. Yeah, you can see spiritual disease. Spiritual disease includes the 5 aggregates of attachment or clinging, upatha, nakantha, tukha. So when we talk about 5 aggregates of attachment, you can remember it includes rupa, corporeality, sanya, feeling, rupa, rupa, okay, corporeality, vedana, feeling, and then the third one is sanya, means perception, and the fourth one is sankhara or sankhara, means mental formation, and the last one is vinyana. So we have rupa, vedana, sanya, sankhara, and vinyana. So altogether, we call 5 aggregates of attachment or clinging, upathan khan. People who do not practice insight meditation, particularly vipassana meditation, tend to cling to the mind and matter. Every time they see, they hear, they smell, they taste, they touch, they cognize something, they usually grasp to them with a wrong view, taking them as permanent, as being happy, and as endowed with entity. That's we call. Instead, you see, they are supposed to see mind and matter as impermanent, as suffering, as non-self and non-ego or egolessness, as I have mentioned this morning. In fact, the spiritual disease is closely associated with the concept of I, he, she, me, and finally related to oneself. So it related to the concept of being I, being he, being she, or related to what we call egoism or ego attachment, as well as self-attachment. Okay, so then we have 4 kinds of disease according in Buddhism too, and also these kinds of disease correspond with the concept of disease, concept of health according to the WHO World Health Organization definition. Okay, then we have already talked about the level of mental defilement. Yeah, we can review a little bit later, okay? Latent or deep-rooted defilement, as I have already mentioned. Yeah, we use the term anusaya kilesa. Anusaya kilesa, they are accumulated since birth in the unconscious or life continuum or bhavanga. They are dormant and latent defilement, namely greed, lopha, hatred or anger, tosa, and titi, wrong view, doubt, vichikicha, conceit, mana, lust for becoming,ภาวะ raga, ignorance, avijja or moha. And this defilement, deep-seated defilement or deep-rooted defilement can be eliminated only by wisdom from insight meditation, particularly from Vipassana meditation. And then we come to the middle level of defilement, pariyuthana kilesa. This kinds of middle level of defilement accumulated in the conscious or active consciousness. Vithi citta, it accumulated in the vithi citta. In fact, these kinds of defilement arise from latent defilement accumulated in the unconscious or life continuum. So when they come to the surface of vithi citta, they manifest themselves as what we call five nivarana, starting with the first one as a sensual desire, kamachanta. The second one is ill wind, payapatha, sloth and torpor. The third one is thina mitha. The fourth one is utthaja, ukuja, restlessness and anxiety. And the last one is doubt or vichikicha. These kinds of defilement can be overcome by concentration meditation, samatha, kamathana, or insight meditation, vipassana, kamathana. Then we come to the third one, the superficial level of defilement. Superficial level of defilement that we call vitikama kilesa. Vitikama kilesa means a superficial level of defilement. These kinds of defilement actually manifest themselves in bodily action or verbal action. For example, regarding bodily action includes killing, stealing, or sexual misconduct. And the unwholesome verbal action such as false speech, malicious speech, harsh speech, telling a lie, vain thought, and something like that. And these defilements are manifested in the bodily action and verbal action. And they are controlled by morality or moral conduct, or sometimes we call precept, the precept sila. And then we have panchasila, the panchasila, like the first one, you can remember, to abstain from killing, to abstain from stealing, to abstain from sexual misconduct, to abstain from telling a lie, to abstain from taking intoxicating drink and other kinds of drugs. Okay. Now we come to this picture. This is a picture of the eye sense organ. So we have the eye, and then we see something with any kinds of visual object, maybe a man, a man, a woman, any kinds of animal. Okay, so the visual object impinge on the eye. There arise eye consciousness. Okay. Oh, okay. Okay. Lower. Oh, yeah. Okay. So when there is a combination of the visual contact, the eye and the eye consciousness, jakku vinyana, This kind of combination we call eye contact. Eye contact. Yeah, eye contact. And according to the law of Paticcasamuppada, okay, contact is the cause of feeling. And in this case, you see, feeling arrive from the eye or with your contact, okay? And then so there are different kinds of feeling from eye contact, okay? So suppose the feeling is good, we call a pleasant feeling. And sometimes the feeling is bad, we don't like it, we dislike it, okay? We have unpleasant feeling. Sometimes we have just neutral feeling, not good, not bad, okay? And unpleasant feeling will give rise to greed or lobha. Oh, I like it. I would like to have these kinds of feeling again and again. On the contrary, if you develop unpleasant feeling, pain, okay, and also rigidity of the muscle, and sometimes you feel restlessness, you tend to develop what we call anger or tosa. Sometimes you might have a neutral feeling, just so and so. You don't make a mental note. You don't understand the reality, particularly when you don't practice vipassana or insight meditation. These kinds of kilesa, mean lobha kilesa, tosa kilesa, moha kilesa, will be accumulated in the unconscious level or in the bhavangha citta or life continuum. So when they are accumulated in the bhavangha citta or in the unconscious, we call deep-rooted defilement or deep-seated defilement. And this deep-seated defilement can be eliminated only by the practice of insight or vipassana meditation. Yeah. Okay. Yeah, I think that's all I would like to mention. So I would like to make an announcement a little bit. So I have written one book. One book is about, in Thai we call มหัศจรรย์แห่งวิปัสสนากรรมฐาน มหัศจรรย์แห่งวิปัสสนากรรมฐาน It is translated as the miracle of insight meditation. I have written this book about 3 years ago. So if you would like to get this book, I think it's available at Wat Mahathat bookstore, Wat Mahathat bookstore, or even bookstore near Wat Bawar Nivet. Yeah, Wat Bawar Nivet belong to Mahamukut Rajavidyalaya. So you can get this book so that you can understand what I have already mentioned more clearly, particularly when you practice what we call insight or vipassana meditation. This book will be a very good manual for you. Okay. Yeah.
Ajahn? What is the name of the book again? The name?
In Thai, มหัศจรรย์แห่งวิปัสสนากรรมฐาน มหัศจรรย์แห่งวิปัสสนากรรมฐาน In English, the miracle of insight meditation, the miracle of insight meditation.
Okay.
Yeah, it's available at the Wat Mahathat bookstore or Wat Bawar Nivet bookstore. Yeah.
Okay,
So it will be good manual for you if you have to practice vipassana or insight meditation. Yeah.
Okay, I think I found it. I'm not 100% sure, but I will put in the chat. Is this the one?
Okay. Yeah. Now I would like to stop my talk this morning at this point, or not this morning, this afternoon at this point. So there might be some question, some concern about what I have already talked, and you might think about something, and you might have some concern in your mind. We can share these kinds of ideas together. Yeah. Okay, go ahead and any question, please.
อาจารย์ครับ
ครับ
I have a question. Many research in the Western saying that MBCT,
Yeah.
mindfulness-based cognitive therapy, can kill the mental disease. How to practice such MBCT ครับอาจารย์
Oh, I think you have to practice both. One, we start with meditation, okay, and then we do something like I just mentioned again and again by practicing vipassana meditation. So when we do the practice, we start with the sitting position, and then we focus the mind at the tip of the nose. Observe the breathing in and the breathing out. Okay, you can make a mental note: in, out, in, out, in, out, like this. And at the same time, you are supposed to see the therapist, particularly psychiatrist or clinical psychologist, at least once a week or twice a week. Yeah. The therapist will use the psychotherapy, but it's some kinds of what should I say? It's not pure psychotherapy. They combine, we call behavioral therapy plus cognitive psychotherapy. So that's why they tend to use the term mindfulness-based cognitive therapy, mindfulness-based cognitive therapy. So it means that so you have to practice both inside meditation, as I just mentioned, and at the same time you have to come to see the therapist, maybe a psychiatrist, maybe a clinical psychologist, talk about your problem, your concern. You might have a personal problem with your dad, with your friend. You might have some kinds of, when you are studying, you might have some kinds of learning problem, studying problem. So when you grow up, when you work, you might have some problem with your work, with your boss, with other people at the place where you are working. It's something like that. So any kinds of problem, you just talk to the therapist, and then the therapist will advise you how to deal with those problems. Yeah. So it tends to be like that. Yeah. Yeah. Okay. Thank you. Okay. Me any question? Please. Yeah. I think this is a very good question. You see, so when we treat the mental disease, particularly the patient who come with anxiety disorder, panic disorder, phobic disorder, so we have to use both meditation, particularly inside or mindfulness meditation, and then the plus psychotherapy. Yes, psychotherapy. So we have different technique in the psychotherapy as well. And as you just asked me, MBCT. The MBCT is one technique in doing psychotherapy. Mindfulness-based cognitive psychotherapy. When we talk about mindfulness, means the mindfulness practice, mindfulness meditation, very similar to what we call insight or vipassana meditation. Any question, please? If there is no more question, so maybe I would like to stop my lecture. This is the last day for my lecture. So I think you have to review what I have mentioned. There will be some question. This time for convenience, I will use MCQ, the multiple choice question, MCQ. Multiple choice question about 30 or 40 questions altogether. Okay. If there is no more questions, so I would like to stop my lecture at this point. So good luck for everybody. Okay, good luck for everybody. And then I may also pay my respect to the Buddhist monk, Bhikkhuni, the nun, and other people as well. Okay, good luck for everybody. Okay.
Thank you, Ajahn.
Okay.
ขอบคุณครับอาจารย์
Okay. Yeah.
อาจารย์ครับจะมีสอบใช่ไหมครับ
สอบเป็น MCQ
สอบเมื่อไหร่ครับอาจารย์
I will send the question to คุณฟลุก Okay, send the question to คุณฟลุก Is คุณฟลุก here? Is คุณฟลุก here?
คุณฟุกไม่อยู่ครับอาจารย์
ไม่เป็นไรเอาไว้อาจารย์บอกว่าจะรีบทำแล้วก็ส่งไปให้คุณฟลุกครับแล้วก็คุณฟลุกเขาก็จะบอกนะครับ
ใช่ครับ so everybodyอาจารย์ saying that he will produce the question first 30 or 40 question and then he will send the question to คุณฟุก and คุณฟุก will communicate with us what the process of the examination นะครับ
Okay, thank you so much. Okay, goodbye.
Okay, thank you, Ajahn.
Yeah.
ขอบคุณครับ
Thank you, Ajahn.